Kaposi sarcoma is a multifocal lymphoangioproliferative mesenchymal low-grade tumor associated with human herpes virus 8 and the most common tumor among patients with HIV. The diagnosis of pulmonary involvement in Kaposi sarcoma is usually determined by a combination of clinical, radiographic, and laboratory findings, together with the results of bronchoscopy and transbronchial biopsy, but it often presents a diagnostic challenge in the presence of other opportunistic pulmonary infections common among HIV patients. We present a case of hypoxic respiratory failure in an HIV patient with Kaposi sarcoma of the lung. A 40-year-old African-American male with a past medical history of HIV, diagnosed in December of 2020, and an unclear history of antiretroviral compliance, presents with 1 week of progressive shortness of breath, productive cough with yellow sputum, and diffuse tightness of the chest. The physical exam was significant for violaceous skin lesions on the face, back, and lower extremities consistent with Kaposi sarcoma. A chest X-ray on admission showed multifocal ground glass opacities suggestive of pneumonitis. Lab results confirmed HIV with a viral load of 6,774 and a CD4 count of 894. The patient was started on broad-spectrum IV antibiotics, fluids, steroids, and bronchodilators. Blood and sputum cultures were collected. The patient was restarted on antiretroviral therapy and admitted to the ICU for worsening respiratory status. On day 11, the patient required intubation due to hypoxemic respiratory failure. On day 12, the patient underwent bedside bronchoscopy with bronchoalveolar lavage and biopsies were sent to pathology. The patient continued to spike fevers without any change in respiratory status. On day 19, pathology confirmed a spindle cell lesion in the right upper lobe suspicious for Kaposi sarcoma. On day 21, ventilator support was discontinued per the family's request, and shortly after, the patient passed away. Pulmonary Kaposi sarcoma is rare and an uncommon form of initial presentation of the disease, affecting less than 5% of cases, and it unfortunately has no cure. It's very easy to confuse the mucosal lesions with an inflammatory process of the bronchial mucosa. The hemorrhagic risk associated with bronchoscopy biopsy procedure in patients with pulmonary Kaposi sarcoma is not negligible. The goal of therapeutic management is to achieve a durable remission of lesions, and it can include local or systemic chemotherapies as well as immunomodulatory drugs. In this case, discussions on end-of-life care were delayed as imaging findings were consistent with pneumonitis and/or ARDS, suggesting that there were further treatment options to explore. This case highlights the fact that it is important to differentiate pulmonary Kaposi from other respiratory illnesses in an HIV patient, as it can change the direction of treatment.